Governor Diane Primavera, Jill Hunsaker Ryan, the head of CDPHE, Joe Barella from the Department of Labor and Employment, Dr. Rachel Herlihy, our state communicable disease epidemiologist, Scott Bookman, who's our incident commander for COVID-19 coronavirus, Mike Willis, the Director of Emergency Operations, and Stan Hilke, the Executive Director of Department of Public Safety. Before I begin, I really want to thank everyone on our team at the state who's been involved with the containment effort at county health departments, at hospitals, for their tireless work to keep the people of Colorado safe. And I'm not just talking about the people behind me. I'm talking about public health officials, medical professionals, all those who are on the front lines across our state as we face this crisis. As you know, my team has been preparing for this situation for months. Last Thursday, we announced the first positive case of novel coronavirus, also known as COVID-19, in the state of Colorado. As of this morning, we've confirmed 15 positive cases in the state and another indeterminate case that we're treating as a positive. In addition to the cases announced yesterday, this morning we have 3 more confirmed positives. One of the cases in Eagle County. That is the 3rd case in the area. And yesterday we sent personal protective equipment, including masks for our healthcare workers, from the state's stockpile of over 600,000 N95 masks to Eagle County. Another case confirmed positive this morning is in Arapahoe County, the 2nd case in the area. The 3rd is in Gunnison County, the 1st case in the area. We fully anticipate that in the coming days, especially as we work hard to increase our testing capacity, that there will be more confirmed cases. And we're going to get through this together, but the actions that we take in the next few days and weeks will really determine the trajectory of coronavirus in Colorado. I've consulted extensively with public health officials and studied the response in other nations, what's worked and what hasn't worked, successful efforts to contain coronavirus like in Taiwan, and failures like in Italy. And I'm basing our approach here in Colorado on what has been shown to work. Today, in order to contain the spread of the coronavirus, to protect our most vulnerable populations, and to maximize our chances of avoiding widespread disruptions to the daily lives of Coloradans and our economy, I'm declaring a state of emergency here in Colorado. Now, you might ask, why this declaration? What it does is it gives us access to resources and more legal flexibility to take steps now to protect the most vulnerable and better contain the outbreak, truly reducing the chances of the trajectory that has occurred in countries like Italy from occurring here in Colorado. With this declaration, we're also taking immediate action, as well as action scheduled in the coming days and weeks, to protect the public health with a focus on the most vulnerable populations. That means people over 60, as well as those who are immunocompromised. I want to walk you through the steps we're taking and why we're taking them. First, one of our top priorities, we're working hard to expand testing capacity in Colorado so that eventually we can reach the point, the sooner the better, where anybody exhibiting flu-like symptoms can promptly get tested. We need more testing because the sooner that we can identify positive cases and hotspots, regardless of the severity of the illness for any one individual, the more effectively we can isolate those who test positive, and we can limit and slow the spread of the virus in Colorado. In addition to making more tests available, we know that people are more likely to get tested if they know they won't be penalized financially for exhibiting symptoms of the virus. That's why yesterday my Department of Insurance instructed insurers across the state to waive costs and fees associated with providing the test. That also applies to state employees. As you know, one of my most important goals as governor, along with Lieutenant Governor Diane Primavera, who's joined me here today, has been to create a system where healthcare costs are not a barrier to people getting the care that they need. Now, that's always true. It's always important, but it's especially true when facing a public health crisis like coronavirus. We don't want red tape to get in the way of people getting the test or the treatment that they need. That's why I'm proud to announce that starting tomorrow, the Department of Public Health and Environment will be opening a drive-up lab for testing at our facility in Lowry. to test anyone who has a note from their doctor stating that they need testing. Let me repeat, because this is important. You still need a doctor's order to get tested at our drive-up lab at 8100 East Lowry Boulevard in Denver. So don't go there. You need a doctor's order to get that test. And again, many of the doctors want to keep potential coronavirus cases out of their practices. That's why we are setting up, starting tomorrow, this first drive-through that will allow for testing. Now, let me be clear, we will only be doing testing starting tomorrow at the Lowry facility, not the CDPHE Glendale facility. Don't go to the Glendale facility. Go to the Lowry facility with a doctor's order to get tested. Now, I'm focusing my efforts in the coming days, as I have in the last few days, of preparing additional safe testing locations that we will be announcing in the coming days, especially prioritizing standing up a testing facility in the high country by the end of this week to prevent spread in our mountain communities and detect those who might have been exposed. We also want to encourage the use of telemedicine as a tool. Kaiser Permanente has the capability to have doctors screen folks virtually and provide a diagnosis allowing those exhibiting symptoms to get tested. I also want to encourage the continued important work at Children's and UC Health to develop, deploy, and scale effective local testing. Now, in terms of test kits, the state currently has about 900 test kits, and we're expecting many more from the CDC. Last night I spoke one-on-one with Vice President Pence, and in that conversation, which lasted about 20 minutes, I stressed the need for exponentially more testing in Colorado. We really need to significantly increase our capacity, and I made a direct appeal for more test kits to be released to Colorado. Vice President Pence quickly put me in touch with the head of the CDC, Dr. Robert Redfield, who I also spoke to last night. Dr. Redfield made a commitment to me to fulfill Colorado's requests for 1,500 additional test kits this week. Dr. Redfield, based on our conversation, called me back later yesterday evening and conferenced in the CEO of LabCorp, which shared with me the good news that as of today, LabCorp has testing capability for their entire physician network. Now, to be clear, the LabCorp tests have a 3 to 4 day turnaround. The tests we do in our state lab have a 24-hour turnaround. But more testing availability is good, even with a longer turnaround, even though it might be temporarily disruptive for people's lives who test negative while they remain in isolation or quarantine during those 3 or 4 days while they're awaiting test results. Again, LabCorp is offering that across their entire physician network, but that doesn't mean you should simply show up. Again, call your physician, call your doctor. Many practices, many hospitals are either seeking to do them in certain locations or, again, the state location at Lowry. But with LabCorp's extensive network, those tests should be widely available across Colorado, again, subject to the comfort level and precautions that a particular provider is taking to ensure that healthcare workers are not exposed. Rest assured that we will continue the pressure on the federal government, and I've had conversations with our congressional delegation as well, to rapidly expand testing capacity and ensure that Colorado has enough tests that we can identify positive cases, isolate them, and quarantine others who may have been exposed. As I said before, in the days ahead, as we test more Coloradans should expect a rise in the increase of positive cases. Now, testing more people is a very good thing. This test is a crucial tool in our efforts to slow the spread of the virus and to ensure that those individuals who have tested positive and need to isolate have the support they need during this challenging time. The bottom line is this: the more people we test and the sooner we do it, the better chance we have at successful containment. In addition to expanding our testing capacity, I'm announcing with our emergency authority additional administrative actions to help contain the spread of the virus in Colorado. Today, with the declaration of this emergency, I'm directing the Colorado Department of Labor and Employment to engage in emergency rulemaking to ensure that workers in food handling, hospitality, childcare, healthcare, and education get paid sick leave to miss work if they exhibit flu-like symptoms and have to miss work awaiting their testing results for novel coronavirus. This step not only helps prevent the spread of the virus, but also inspires confidence for both tourists and Coloradans that we are minimizing risks in our state, especially in professions that could potentially be significant vectors for contagion. For those workers who test positive and who lack access to paid leave, we've asked Colorado Department of Labor and Employment to identify additional supports and wage replacement, such as access to employment insurance. Now again, so the paid leave would be for the period of the testing, could be 24 hours, could be the 3 to 4 days with LabCorp. But then we're looking at additional measures around unemployment insurance and wage replacement for the positive confirmations, so that people are able to make their rent and afford food if they are unable to earn any hourly wages while the case of coronavirus has been confirmed. For those workers who test positive, we feel that these steps are very important because for those who work with vulnerable populations, for those who work in food services and hospitality, for those who work with older Coloradans, it's absolutely critical that they are able to take that sick leave if they are ill. When those workers lack access to paid sick leave, it poses a great risk to our ability to protect the public. Now, the men and women in these professions want to do right by their fellow Coloradans and stay home when they're ill, but that's a very hard call when the loss of wages could mean missing rent or not putting food on your table. I'm also requesting that the private sector of Colorado voluntarily offer paid sick leave to those who don't have it already, so that they can collectively be part of the solution in doing their part to contain the virus in Colorado and protect additional disruptions to our economy or way of life. As far as state employees go, we want to provide as much flexibility to ensure the state functions continue to run smoothly while also keeping people safe. For state employees who may be either put into quarantine or isolation, they will have the opportunity to work from home in many classifications of state jobs, and if they have that opportunity, they should do so. If workers fall ill and can't perform their duties, they will be able to use paid sick leave, and the state will be as flexible as possible with that paid leave. For instance, there are some impacted employees who cannot work from home. That might mean prison guards, it might mean some of the frontline CDOT workers and assisted living staff. We're working to ensure that paid leave options for those who are ill help ensure that these workers can continue again to pay their rent and put food on their table while preventing them from spreading the virus and being a threat to public health. An additional step that we're invoking with our emergency authority is we're asking the Department of Revenue to temporarily allow Coloradans over the age of 65, a vulnerable population, to extend their driver's licenses online to avoid having to congregate at Department of Motor Vehicle sites at this time. Now, some of you might not even be aware of this, but in our state, if you are 64 or younger, you can renew your driver's license online. If you are 65 or older, you have to go in person. Now, in normal times, people can debate that a law like that, and I'm sure you can make a capable argument on either side. You know, people who oppose it might say, why does it discriminate against seniors? People who support it may say, well, we have concern that their eyesight might deteriorate and they should show up in person when they're 67 or 70. But the prioritization and the reprioritization in a public health emergency like this is to say, look, the equations that the legislature and governors have made through the normal statutory process is temporarily different. And right now, that priority is to make sure that people 65 and up are not, in fact, congregating at DMVs. We have at least one instance of a confirmed coronavirus case who visited a DMV in Douglas County. And again, it's important to protect our most vulnerable populations. These orders, both the wage order and extending the ability for people 65 and up to renew their driver's licenses online will both be reviewed on a 30-day basis. There are 30-day orders, and we will renew them as needed as long as this public health emergency lasts. Within the next day or two, we will also be issuing guidance to schools and nursing homes on how best to protect their communities from spread, as well as protecting our most vulnerable at our nursing homes. We're acting quickly and decisively because the quicker we can contain the spread of coronavirus in Colorado, the better we'll be able to protect our most vulnerable populations, seniors and those with underlying health conditions. We have a lot of evidence from other areas that this has hit that shows that about 80% of people who get coronavirus can manage their illness on their own at home using over-the-counter medication if desired to treat the symptoms. But about 20% of the cases and a significantly higher percentage of older Coloradans and Coloradans with chronic illnesses may have more severe cases, may require hospitalization, and yes, unfortunately in some cases it can be fatal. According to the statistics coming out of China and South Korea, the fatality rate of the virus is significantly higher among seniors. In fact, the rate grows with each successive age bracket. We need to do everything we can to keep those most at risk safe. In addition to these specific actions that I've outlined today, I won't hesitate to use my emergency authority to take additional decisive actions to protect our most vulnerable populations as well as the facilities that serve them, including nursing homes, assisted living facilities, senior centers, and healthcare providers that serve older Coloradans. Thankfully, we have not yet had any incidents at facilities that are focused on serving these populations, but other areas that have experienced the outbreak have. That's exactly why we're taking these forward-thinking actions now to reduce the likelihood of these incidents in the future. Our goal is not only to save lives, but it's also to prevent the sort of widespread disruption that we're seeing in China, in Italy, and other areas of the world. We have the benefit of learning from the experience of other countries that are a few weeks ahead of us in successfully handling the outbreak. The actions we're taking today, the targeted interventions, expanding our testing capacity, are aimed at using these lessons to avoid broader disruption to our state and our economy. It's important for me to say that declaring a state of emergency does not mean that Colorado isn't open for business or recreation or tourism. We are. Nor should this declaration cause more anxiety or panic. In fact, quite the opposite. We hope that these actions provide reassurance that we are aware of the risk and taking every reasonable step that we can to contain the spread of the virus and protect our most vulnerable. For instance, we should all feel more comfortable eating out, knowing that the chefs and waiters don't have to come to work sick. With proper containment, we're hopeful that we can avoid major disruptions to economic activity, avoid prolonged disclosure of schools and workplaces, and avoid prolonged limits on transit and movement that we are seeing in other nations that didn't act quickly enough. Most importantly, however, we all have a role to play in preventing this from spreading. There's only so much that any government can do. At the end of the day, the success of our response depends on individual responsibility. It depends on the public taking this threat as seriously as our state and local health authorities are. Truly, the decisions we each make, our collective actions, will dictate how this plays out in the state of Colorado. For those who are relatively young and healthy, they need to recognize that this virus is a potentially lethal threat to older Coloradans and those with chronic illness. Everyone should be practicing the common sense steps that are recommended by the CDC to protect yourself from contracting coronavirus. Avoid close contact with people who are sick. Avoid touching your eyes, nose, and mouth. Stay home when you are sick, and keep your children home if they are sick. Cover your cough or sneeze with a tissue, then promptly throw the tissue in the trash. Clean and disinfect frequently touched objects and surfaces using a regular household cleaning spray or wipe. And again, very importantly, wash your hands often with soap and water for a period of at least 20 seconds, especially after going to the bathroom, before eating, after blowing your nose, coughing, or sneezing. You can't wash enough. If soap and water aren't readily available, use an alcohol-based hand sanitizer with at least a 60% alcohol content. If someone in your home is sick, avoid sharing dishes, drinking glasses, cups, and eating utensils or bedding. After using those items, wash them thoroughly with soap and water. And then choose a separate room in your home that can be used to separate any sick household members from those who are healthy. These are critical steps in individual responsibility that are incredibly effective in preventing the spread of COVID-19. And I would also add are incredibly effective in preventing the spread of the seasonal flu and colds, which are also in their high season. Smart hygiene practices make us all safer and prevent further disruption to our state, our quality of life, and our economy. Now, if a person is exhibiting symptoms of coronavirus, like a fever and coughing and shortness of breath, and you haven't yet been tested, the following steps should be immediately advised for that person. Number one, that person should not attend public gatherings. That person should increase distance for close contact. 6 feet is a minimal distance that can begin to reduce the risk of transmission, which is mostly spread through coughing and sneezing through the air. The person experiencing symptoms should continue to practice basic hygiene like hand washing with soap and water or hand sanitizer during this period. And the person should call a medical provider or nursing line before going into a health facility. Once again, if you're exhibiting flu-like symptoms, and feel you're at risk for coronavirus, don't simply go into a health facility. Call your medical provider or nursing line before going in. Some of them have separate entrances. Some of them might write up an order for you to go to our drive-through facility. There's a number of different things. But again, place yourself responsibly in isolation. Again, avoid whether you wind up having the flu or coronavirus or a cold, you don't want to spread that to others, and you want to do your best to contribute to supporting the health of Coloradans. If you're instructed to seek care, follow the precautionary advice of the medical provider before going into health facilities to avoid spreading the virus. Your medical provider will evaluate you, determine if testing is needed for influenza, the flu, or other respiratory illness, or coronavirus. And telemedicine is really an important tool. The provider can make a diagnosis without a potential case coming in for an appointment and potentially exposing others. So it's very important that that first contact be on the phone or online. Now, if a patient needs to be tested for COVID-19, the medical provider has a number of options. They can collect a specimen from the patient's nose and throat and send the samples to the state lab or to LabCorp, or they can direct that the patient go to the CDPHE facility in Lowry that will be open again starting tomorrow, or another commercial lab that's capable of doing the coronavirus diagnosis. Now, the state lab is prioritizing tests that meet the current criteria, that you have a fever or symptoms of lower respiratory illness like a cough or shortness of breath, and you've been in contact with someone who has had COVID-19 within 14 days of when the symptoms started. The patient has a fever or symptoms of lower respiratory illness, and the patient recently traveled to parts of the world where the infection rates are higher, or there is severe acute lower respiratory illness without alternative explanatory diagnosis, right? So if influenza has been ruled out, that would be a priority category for state testing. I want to thank the folks at our state lab who've been working in nonstop shifts, close to 24 hours a day, 7 days a week, to turn these tests around as quickly as possible. The Vice President and the CDC are seeking to increase the supply of those testing kits to Colorado. But again, our need is for an exponential increase in testing. We hope to accomplish that in 3 ways: through the increased availability of testing, through our state lab, through the coming online of other providers like Children's and UC Health that are working on this as we speak, and finally through partners like LabCorp that might have a longer turnaround but are widely available through their network in Colorado. They work with almost every practice in our state for testing. I know that this is a challenging time, not just for Colorado, but for the United States and for the world at large. That's why my team and I are working around the clock to keep people safe and to successfully contain the spread of the coronavirus, to protect our most vulnerable populations, to protect our economy, and to protect the public health at large. We'll continue to learn from and examine successful responses in other nations. We also learn from unsuccessful responses of what not to do, and we want to implement the best practices here in Colorado in a timely manner. And you can expect that there will be additional announcements of additional steps in the days and weeks ahead to minimize the potential of severe disruption to our economy and to our lives here in Colorado. I want to thank all of you for coming to this important announcement, and we'll be happy to take some questions.
How many cases have the CDC confirmed as positive?
So CDC has confirmed more than 400 cases at this time. Their website is updated daily at noon Eastern time.
I'm talking about in Colorado.
These are presumptive cases. They have been identified by our state lab or by other private testing providers.
I thought you said that the CDC would have results in 48 hours last week.
These are questions for the CDC, not for us. We are turning around tests in our state lab within 24 hours. LabCorp is 3 to 4 days. The CDC protocol would be an appropriate question for them.
For the orders on paid family leave and the 65-year-olds not going to the DMV, when do those take place? I know you've
Yeah.
given the order, but when does that actually take place?
As soon as practicable. So the Department of Labor and Employment is concurrently working on the order around the sick leave, and there will need to be some technical changes done on the online system for the driver's license. But again, we expect it within the next couple days.
You say that Colorado is open for business, yet you've declared a state of emergency. At least one large convention has been canceled. What is your recommendation regarding large gatherings of people?
Again, those who are most at risk, our most vulnerable population, those over 60, those with chronic illnesses, should avoid unnecessary large gatherings. We want to inspire confidence that Colorado is taking the steps that we can to protect against the kind of disruptions that we see in Italy, which are devastating from a quality of life and economic perspective, and we think that by acting boldly now, we can reduce the risk of that trajectory in Colorado.
Governor, last weekend and through the weekend, the CDC vastly increased the guidelines for testing. And yet, here in Colorado, doctors are not getting that message yet from your state Department of Health. When can we expect those expanded criteria to apply so that doctors get the same message from CDC that they're getting from CDPHE?
We, again, encourage now that they have LabCorp has come online as a partner. Most of the doctors in the state are able to use LabCorp as their testing partner.
The state has yet to change the criteria online for doctors to go and look at, and I'm hearing from a number of doctors that remain frustrated because they don't know what the guidelines are for testing.
Yes, we want, again, if you're exhibiting flu-like symptoms, we would like to see you tested.
But that's not happening.
Well, and hopefully then people are getting the message that it should happen right now. I want to be clear, this couldn't happen until today because LabCorp wasn't available for testing. This is a new announcement, I believe they announced it last night, that LabCorp has come online for testing. Our state lab has very limited ability. We have 900 tests. We have another 1,500 on the way. That's the assurance of the head of the CDC. That would not be a sufficient number to test everybody with flu-like symptoms. That's why partnering with LabCorp, as well as both Children's and UC Health coming online, are critical if we are going to reach a point where we can test everybody with flu-like symptoms in Colorado.
Governor, I know yesterday some of the cases that came out had people fearful of community spread happening in Colorado. Do we have any update on whether or not that's happening?
While we don't have a confirmed case of community spread in Colorado, we have several candidate cases where it's possible, and based on the trajectory in other areas, we are expecting that first case in the coming days.
So speaking of community spread then, have you considered, banning big public gatherings? Is that something that you guys are talking about yet?
Again, at this point, I think what's important is that the most vulnerable population, those over 60 and those with chronic health issues, avoid unnecessary public gatherings.
At this point, there was more flu cases and flu deaths than from the coronavirus. Why the heightened measures surrounding?
All the steps that we've gone over today are just as effective at preventing the spread of the flu, the common cold, strep, any of these airborne illnesses in addition to coronavirus. The concern, obviously, with coronavirus is it is significantly has a significantly higher fatality rate than the flu. While again, the data is still out, it's between 0.6 and 4% fatality rate for coronavirus, but again, significantly higher for people over 60, over 70. So, I mean, you're talking a fatality rate 2 to 3 times as high for some of those most vulnerable populations that these steps that we're taking today will help protect.
I know you obviously have done things to help protect people who get the virus with sick leave and insurance, but anything you're looking at to help try to protect the state's economy?
Yeah, we feel that these measures will help protect the state's economy by inspiring confidence that the state is taking action, by making sure that people who are waiters and restaurant workers and work in hotels aren't going to work sick we hope to send that message that Colorado is in the forefront of taking actions to prevent the further spread of coronavirus, and that we are open for business.
Governor, in addition to the steps you've outlined today, can you talk more about what your administration is talking about potentially in the coming days, depending on...
You will hear additional announcements in the coming days, particularly targeted around preventing outbreak and protecting our most vulnerable populations.
Does the state of emergency loosen any restrictions for who gets tested? So is it only people who exhibit symptoms, or is it people who test and make
Again, we need to increase the availability of testing exponentially, meaning that we need to reach the point where we are able to administer the test in Colorado to anybody with flu-like symptoms. We're closer to that point now than we were a week ago, than we were 2 days ago. We're doing that by increasing testing capacity at the state lab. Number two, LabCorp has come online with the ability to scale. Again, a longer turnaround time, but significantly more ability to scale than the state lab. And then, of course, we're continuing to encourage our local partners, including Children's Health and UC Health, to rapidly develop and deploy and scale testing on a local basis.
We'll take 2 more
Governor,
questions.
I don't recognize there's a need to protect patient privacy, but there's been very limited information put out about where these confirmed cases, where these people have traveled in the days leading up to their diagnosis. Why not give people more information so that they have the ability to avoid those places or seek testing if necessary, because people might not know they've interacted with somebody who's a confirmed case?
Yeah, as that information comes online, if there are legitimate health risks, residents of those areas will be made aware through county health departments. There have been additional details on most of these cases that have been issued through the county health departments about what those who have been affected have done, as well as trying to track those who they've been in contact with and identify them for quarantine and for testing.
Governor, how many tests per day have you been doing, and what will the capacity actually expand to with LabCorp?
Every day, the state is releasing the number of tests that we do, positive and negative. You've hopefully been getting that every day. We don't yet know full visibility daily, and I don't think we will, into the number of tests that are being sent out to LabCorp, but we will do our best to be transparent with any information that we have. Again, keeping in mind that we might not have all that information on a daily basis. We certainly do have our state lab information, and we are releasing that usually multiple times a day, but at least daily. Again, any participating part of their network, which are most doctors and labs in the state that currently have a relationship with LabCorp. I talked to the CEO of LabCorp yesterday. He also indicated that if you have a practice that doesn't currently have a relationship with LabCorp, they have expedited to allow that to be set up with papering it later. So they feel that you can get to the point where you're sending out those samples within 24 hours and set up the normal relationship with them in the days after that to reduce any delays for any physician or lab that needs to establish that relationship so that then they get more testing out.
Question here.
So the message that we seem to be hearing out of Italy is that we should have done a lot more, a lot sooner. Is there a tension between trying to keep the state open for business and avoid disruption and actually containing this?
Again, we are really looking at some of the successful models like Taiwan which has successfully contained the spread of the virus. We will be in the coming days issuing guidance around schools, around nursing homes, and by taking these actions now, we are hopeful that we can avoid the significant closures and devastating impact to quality of life in the economy that is occurring currently in Italy. And could occur absent taking these important steps early that have been demonstrated to work in other countries that face what we're facing now about a month ago. Thank you.
Thank you.